So polycythemia vera is a chronic malignancy of blood cells whereby patients typically acquire a mutation in a protein called JAK2, which leads to the overproduction of many different blood cells, red blood cells, some white blood cells, and platelets. And it's really hallmarked by the overproduction of red blood cells, which makes up our diagnostic criteria. And while oftentimes people will refer to these as the good bone marrow cancers to have, I mean, there's no such thing really, but we do expect patients with this disease to live for quite a long time, sometimes decades. But what we worry about is an increased risk of thrombotic events, so blood clots in the veins and the arteries, such as strokes, heart attacks, DVTs, PEs. And that's really what we focus our treatment on is preventing those thrombotic events, as well as maximizing quality of life in a disease that also is associated with a diverse array of symptoms, such as sometimes fevers, chills, itching, fatigue, profound fatigue, and also symptoms that come from iron deficiency, which is also somewhat inherent within the disease as the body uses up all of its iron stores to make red blood cells. Polycythemia vera is a disease that oftentimes is diagnosed based on routine blood work. And so it's not surprising that the median age of diagnosis is somewhere in the range of 60 to 70 years old. You know, those are the folks that are often going to their primary care doctors and having a lab work done. Occasionally it's folks that are getting maybe a health insurance evaluation that sees some abnormal blood work, or perhaps are donating blood and see some abnormal blood work, or getting ready for a surgery and see some abnormal blood work. On the other hand, some folks deal with kind of problematic symptoms that have been ongoing for some time, debilitating fatigue, unexplained itching or pruritus that leads to this diagnosis. But ultimately, you know, it's typically the lab work that shows these high levels that leads to further investigation. In some patients, you know, it's pretty quick that they see the lab work and ultimately get the diagnosis. And other times, maybe these are more mild lab abnormalities that go kind of unnoticed or uninvestigated for a few years that ultimately then leads to a diagnosis down the road. In some patients, because I mentioned, you know, these diseases come with an increased risk of thrombotic events, some patients will present with a thrombotic event. Or oftentimes you hear that, oh yeah, you know, I just got this diagnosis, but maybe 3, 4, 5, 10 years ago, I had this unexplained blood clot that no one really knew why it happened to me. And so, you know, it is a diverse way of presenting with a diagnosis, but sometimes it can take some time to establish it.